Each summer, hundreds of migrant families head up from Texas to work in the fields of central Indiana. This mobile army of mothers and daughters, fathers and sons, has the same concerns as any family unit, and that includes health care. But how to reach people that move from town to town and farm after farm? Well, it takes some doctors on wheels.
Chances are you'll never meet the people who help put food on your table. About 6,000 migrant workers return each year to Indiana to work in the fields or do shift work in the packing plants. It is big business. Tomatoes are the state's third largest crop. Indiana is number 2 in the nation in tomato production. It is a mobile workforce, here when the season demands it, working 10-hour days, 6 to 7 days a week, no holidays, no paid vacation, no benefits, no medical insurance. The 3 generations of the Hernandez, Mejia, and Aguilar families are typical. They are American citizens who travel from South Texas to work central Indiana's tomato fields, including the Utterback Farms, 300 acres.
There's a lot of talk about taking jobs away from here. There's just no way that a high school kid or a 20-year-old would do what they're doing. I commend them on that because they're hard workers and people don't realize.
And many may not realize that for a mobile workforce, mobile medical care is required too.
I think it's a great thing. They can go somewhere, one single location, and get all the health care they need. Indiana Health Centers staffs and deploys the Health Check mobile unit to the migrant camps, including Red Gold's largest packing facility in Orestes. It's a one-stop primary care center.
These folks are truly hard-working people. Without us doing this, these folks would end up in emergency rooms, and it would cost everybody more money. It'd cost taxpayers more money.
I'm not real comfortable with her blood pressure being this high, so I feel like she really needs.
Rosa Ballesteros complains she gets dizzy 8 hours into her shift.
Doctors and our providers, they have the ability to write prescriptions for them. They have the ability to dispense medicines that the population may need. And those are all available to our folks that have no insurance.
Migrant farm workers are at 33% higher risk for high blood pressure and diabetes. Metabolic syndrome, which is a diabetic hypertensive coronary artery disease, is very high in the population.
They get a lot of one-on-one attention. They have some very caring resources and people here that not only to take care of them, but also their children.
335 migrant workers and their families live and work at Red Gold's Orestes plant. The company houses them here. During the days, the children are taken to school, provided by the Texas Migrant Council, so they can get an education.
These people really come for work. These people come for doing a great job, for not looking for problems, and saving money for take care of the family in Texas or in Mexico.
And for the workers themselves, it's not just staying healthy. It's staying healthy so they can keep working.
Their perspective of what my job is to get them back to work, not to put them off work. That's not their goal. They want me to find out what's wrong with it, treat their problem, and then get them back so they can go back to work. Now, how about your diabetes?
124.
134, great.
124.
124, that's even better. Here.
Linda Garcia works second shift at Red Gold. She's a second-generation migrant worker.
These people are so nice and everything, and I'm so grateful here, that the doctor's here.
This is Gene Brown's 23rd year with Indiana Health Center's Migrant Medical Outreach. It's one of the reasons he stays in community medicine.
I feel very strongly that when people are in need, my job is to reach out. And being able to reach out and being in my position, I tell people I have the best job you can possibly have. Every day I can go to work and look forward to working with people that I like. It's a challenge, and it's a wonderful privilege to be able to treat these people.